Hello, my name is Sheila Murphy, and I'm Vice President for Advocacy Programs and Initiatives at Research America. And I'd like to thank you very much for joining us today for this very interesting conversation that we're going to have. And thank you for your partnership in Research America. If your organization is not a member, please stay on as our guest, but please get in touch with my colleague Joel, who's head of membership for Research America. He's happy to connect with you to discuss the various aspects of becoming an Alliance member, and his email will be in the chat. And then today we're very pleased to be joined by Dr. Rebecca Cunningham, who is a noted firearm injury researcher and Vice President for Research at the University of Michigan. She will talk about the role that research plays in confronting the day in and day out tragedy of firearm injury and violence. As always, please put your questions into the Q&A box or the chat, and we will try to get to as many of them as possible during the Q&A session. Thank you so much for joining us, and Dr. Cunningham, over to you.
Great. Thank you so much for having me today. I'm just thrilled to get to have this conversation. And looking here for my slides to start. So maybe go to slideshow mode there. There we go. Perfect. So, just to start us off on a conversation to make sure that we have shared understanding, I always like to talk about what I view firearm injury and firearm injury prevention to be. So when people think of firearm injury and gun violence these days, they have a lot of news articles, a lot of emotional reaction to what their experience has been and what they're hearing. And from a research perspective and an injury prevention perspective, I think of firearm injury as really many things. It's really not one even type of injury. It is school shootings and mass shootings, the horrific, all too common occurrence currently. It is peer and partner violence by gun. It is young children finding a gun, or even adolescents or other people finding a gun that they shouldn't have access to and having it accidentally go off. It's community violence and street violence. It is homicide. It is suicide. So these are all the different kinds of firearm injury that we'll be touching on today broadly. Next slide, please. I just want to start by saying we all bring to this our own perspective. And as a researcher, I bring my own perspective as well. I also bring the perspective of a physician. And my starting point from this has been a physician who stood at the bedside taking care of far too many young people, old people, all kinds of people, our community members who were injured by a gun. And that's the perspective that I bring, which is I wanted to have come to this in how we could prevent people from coming into my trauma bay. But there's a wide variety of perspectives on this topic. And in order to make progress going forward, we need all of those perspectives involved, whether you're a teacher in law enforcement, whether you're a hunter, a responsible gun owner, a high school student, a parent, business owner, neighborhood watch owner, and regardless of your political affiliation, we all have a perspective, and those perspectives are all respected in a forward-looking way here, and how we can work towards what I view as a common goal that we have to have in research here is that how do we decrease firearm injury and death in our nation? Next slide, please. A little bit about what we know. What does the data show us currently? Next slide. So this study was one my group was able to do a few years back. The original study done in, I think, 2017 or 18, we were asked to address and list what the leading causes of death were among children and adolescents in our country, to try to put that in perspective into gathering a collective understanding. Is this something that's just in the news a lot more now and is being hyped up, or is this really a major cause of injury among our children and adolescents? And what we found here was that for children that lived through their infancy in America, to their 18th birthday, that these are the major causes of death. That blue line at the top is motor vehicle crash. We see a tremendous decrease from 1999 through 2020 in motor vehicle crash as a whole. That third line, that gray line, is malignant neoplasm, otherwise known as cancer. Childhood cancers has been very steady throughout the past 2 decades. drowning, asthma, fire, and burns. But what we see here in the middle is that this orange line has represented that over the past several decades, firearms have been was originally the second leading cause of death among our children, and in 2019 surpassed motor vehicle crash to be the leading cause of death for children who live through their infancy among our children and adolescents through the age of 18. And the other thing I'll just point out is, as a researcher, I really started my research career just about that 1999 time. It's about when I started working clinically and working with and seeing patients. And during that time, I could feel palpably the decrease in people coming in that were severely injured by motor vehicles during that time. I also felt palpably that during that entire time, that orange bar really felt the same, that we were making no progress at all, and could start to feel that increasing over the subsequent years. And the other thing I'll just say for a research community is this is during the course of really one researcher's generational time to be able to see that difference of that blue line going all the way down. And so, I put forth always to our trainees and our early researchers working on this topic, and what research could do. Research in their generation could move that orange line if we work collectively down to have the same amount of decrease as what we've seen in the blue line. It is possible, and it is possible with the time of our generation. I put these little QR codes here. People can find the original articles. Next slide, please. So that was a slide on children and adolescents, and this is a slide that notes where we are as a country totally for our full population. And we can see in this realm, the colors are reversed, firearms being blue, motor vehicle crash being orange. And we can see here also that firearms surpass motor vehicle crash as a cause of death in about 2017, 2018. We know that across the country that about half of those are suicide, a little bit less than half of those are homicide. There's been a tremendous increase, 30% since 2014. That suicides are really impacting a lot of our veteran population, have a much higher rate of overall suicide rate by gun. And that the feeling that we have in our communities and nationally that mass shootings are increasing is not simply a factor of the news, but is borne out by the data in 52% increase in incidents from, that should be from 16 to 21, somehow it's reversed and then 20 to 21, sorry about that data. And this is a tremendous, not only emotional cost and costs on our families and our communities, but also has a clear dollar cost that is extraordinarily expensive for our country and our healthcare systems. Next slide, please. This is also a burden of injury and disease that has substantial racial and ethnic disparities that one needs to be attentive to. Our homicide rate with gun for Black Americans is 6 times higher than other racial groups. Suicide rates by gun are higher among our white and Native American Alaska groups. And we really need to think about, when we're looking towards solutions here, also the structural factors of firearm injury over the century, systemic racism and economic disinvestment as related to homicides, and distress and poverty, mental health access as related to both, but also to suicides. Next slide, please. Often there's myths around this is an urban problem, this is a X community problem, this is a Y community problem. I mean, the fact of the matter is this is a problem in all of our communities. But if we look overall, suicide rates are higher in our more rural, which is on the right side of this slide, communities. This is all by gun. Homicide rates by firearm are higher, slightly higher, not as much higher as one would think in perhaps with urban lore in our urban communities. Overall, our rural communities are actually experiencing more death by firearms than our urban communities. The point of this being really, this is an issue for all of our communities, suburban and urban. Next slide, please. When we look at that again by in children and adolescents, that last one is not for our whole population. And sort of the question that's asked here is, our kids, we've talked about our kids and adolescents here are dying, in high school and in elementary school. by firearm, and we looked at what communities that's happening in. Again, is that one community more than another community? And I'll point you here to the middle aspect where we see for firearm injury, those bars are about equal, which means children in our urban communities, suburban communities, and rural communities are dying at very similar rates per 100,000 by firearm. This is a problem for children and adolescents across all of our communities. And as I pointed out before, across our population in general, across our communities, we all need to be thinking about solutions. Next slide, please. All this data has inspired me, and I hope will inspire researchers across the country that we really need to be thinking upstream. It was certainly too late to be thinking about this once folks arrive at our hospital door, although good trauma care has helped. We need to be working upstream and thinking about effective prevention methods. Next slide, please. So what's a framework, a research framework for developing solutions here? One that has worked across other types of injury, other types of disease, is define the problem, identify risk and protective factors, develop and test prevention strategies, implement promising initiatives, and then monitor, evaluate effectiveness, and work again on the problem. That stepwise framework, which is the same for firearm injury as it is for any other type of injury and most diseases to be approached in a research framework, means you need the data and you need research for that and funding for that to generate the knowledge, which also takes research funding and research people. And then you need to move that research to action, which also takes implementation work, research funding, and good examination of the solutions and how well they work. Next slide, please. So where did we get off track on this in the country? In the late 1990s, the Dickey Amendment was passed, and that really silenced the federal funding around research on this topic, decreasing it dramatically across the CDC and across the NIH. So what that led to is by 2010, the total federal research on gun deaths was only being funded at about $135,000, not million, $1,000 for the entire nation to study, if you remember from the first slide that I showed you, what was then the second leading cause of death among children and adolescents. So we really were not funding this. By about 2011, by the way, if we're not funding it, then that means we're not generating the data, we're not generating the knowledge, we're not implementing the solutions to how we're going to move ahead. By 2011, that also meant we only had a handful of firearm researchers in the US. Researchers require funding, academics and universities require the ability to progress across their careers. They require funding to do that. So we had only a handful of firearm researchers left. And what did that mean? By 2017, when gun deaths surpassed car deaths for teenagers, it wasn't even a headline in the country because there weren't any scientists around who were studying gun deaths specifically to be looking at that data in a concerted effort way. Now we have more, and that kind of data leap wouldn't go unnoticed, but it did in 2017. Next slide, please. This was a study we did, and the QR code is there on the bottom. It was in Health Affairs, where we actually looked at the funding specifically for children and teens on selected causes of mortality, just really to highlight that when we say it's not that we haven't, that there aren't solutions that are possible for this. It's that we weren't trying to find solutions for many years. So for example, to decrease childhood cancer, just childhood cancer, the mean funding for those 10 years was $335 million a year of concerted effort to decrease how we are going to have less kids dying from cancer. Just for children and teens, by a very conservative estimate, we were funding over $88 million a year in funding, in research funding, that worked to decrease that blue curve at the top, and that's not even including the funding that was happening for adults at the time. For congenital abnormalities in children to prevent deaths, again, $36 million a year. For between 2008 and 2017, we were funding $1 million a year for firearm injury. And with that, we were not able to find a tremendous amount of concerted solutions to move us ahead here. That meant we had less less publications coming out, less knowledge being generated from that box I had before, and with less knowledge to action. Those are the effects of downstream decrease in research funding. Next slide, please. So we got off track. The track is windy. We are getting back on path in the country in addressing this as a research issue, and one that can be addressed by standard data, knowledge, action platforms. Next slide, please. Let's look back a little bit. Next slide. If we look at this car, which is somebody will tell me who knows cars better than I, this is circa 1960s. When this car crashed with this picture in the 1950s and 60s, we would have said that it was the driver's fault. This must be a driver who was did something wrong, and that's the reason that they died in this crash. They almost certainly did die in this crash. To look at it today from an injury prevention standpoint, we know that there's many system effects just looking at this picture that were put in place in subsequent years. For example, we try to not put big poles like that right next to highways. We have crash compartments and engineering solutions and airbags that would make it, if someone did hit that the front car would crumple and that they themselves may not be killed and be able to walk away. Next slide, please. With that sort of approach that's broader than the individual driver responsibility, but a path that affects how we design roads, how we design cars, what we do for drunk driving, how we address high-risk individuals who perhaps are too drunk to be behind the wheel of a car. Those are the types of thinking that we now can apply to how we decrease firearm injury. Next slide, please. So just briefly introducing here, there's a multitude, just like we had for that car, a multitude of research-based paths forward that can decrease firearm injuries and death. There are individual level interventions that can be done that will help with counseling high-risk individuals in how they can be safer and not have interactions with guns. But there are organizational level interventions that can happen. Many universities are developing. We here at the University of Michigan have developed a firearm injury prevention research institute. Northwell Health is just gathering CEOs across healthcare systems to begin to think in a concerted way what their efforts can be to affect firearm injuries and have prevention. At the community level, there's many interventions that are possible, from campaigns on safe storage to urban renewal. On the left here, I show just an example of the difference between a lot that has been what we call sort of broken windows theory, where the lot and that urban area is distressed, versus cleaning that area up. We know research has shown us that actually there's a difference in violence once we treat our communities and we green them and clean them in that way that busy streets model shows on the right there. There are, of course, also policy options, and they require research behind them to understand which policies work and which policies don't. Policies such as extreme risk protection orders, safe storage, child access prevention laws, CAPS laws. So all across the spectrum here, one of these alone will not work. Certainly an individual level alone will not work, but a combination across every level, every ecological system with many, many efforts at each level will be where we begin to decrease the terrible toll of death in our country. Next slide, please. So what can we all do as individuals? So first of all, in your own community and school and workplace, you should know the firearm facts and myths that I just talked about. We should collectively understand that gun deaths are preventable. This is not something that we just need to accept in our society in the same way we don't have to accept that that car is going to hit that pole and everybody in it is going to die. We need to support evidence-based prevention programs, and I'm talking here to a research-based organization. The DARE program was widely put out, but did not work. wasn't the evidence behind it. We need now to be putting our dollars towards implementing programs that have shown to have an effective evidence base behind them. In order to get that evidence base behind them, we need real research funding and research programs. We need to talk about firearm violence and on shows and programs like this and all across our ecosystems. We need to move beyond silence. Next slide, please. We need to focus on gun safety in the same way that we focus on safety across other types of injury prevention. We live in a country that has many pools. We live in a country that has many cars. We live in a country that has many guns. We need to take a framework here that says, how are we going to have a harm reduction approach? When we start with statements like the safest home is one without a pool, and we discuss eliminating all the pools in a community, we will immediately alienate all the people who have pools, and we will not increase the safety of those pools. So we need to work together with our community, focus on safety and harm reduction, risk assessment, and meet people where they are and do coalition building. Next slide, please. I want to just mention that it seems like these things are impossible and impossible over our lifetime. They are of course, not. These were advertisements that occurred in my mother's generation. I hope that they don't occur in mine, and I hope in my daughter's generation, we will not have the issues that we have now with gun violence, but that's going to require substantial change and action. Hope is not a strategy here. Research that produces action that is evidence-based is a strategy. And so with that, I'll leave you after just that quick overview, because I want to make sure we have good time for questions. I want to, as you go to the next slide, just mention that, two things here. As I leave this up, I'll talk for a moment. The NICHD funded my group, along with Mark Zimmerman and I, a few years ago, to create a consortium called the Firearm Safety Among Children and Teens Consortium, the FACTS Consortium. This grant is now finishing its 6th year. And what we were set out to do and tasked by the NICHD was to really help build capacity for research across this topic, capacity that had been lacking. I mentioned before that there were not that many firearm researchers working. There was not very much funding for research, and the NICHD and our consortium of 25 plus faculty across 12 plus institutions across the country banded together to begin to work to address that capacity issue. And we did that in a couple of different ways. One, we worked to develop a pediatric specific firearm injury research agenda, which we published in JAMA Pediatrics, which outlines probably 100 questions that immediately could, with research funding, could advance knowledge that would produce action and would begin to decrease firearm death among children and teens. We designed some core studies to provide preliminary data, and I'm happy to talk about those to fill the early data needs so that we could build larger studies that would find meaningful results. We developed a web-based searchable data archive here at the University of Michigan and ICPSR, which holds over 100 data sets now of prior research on firearm that includes the variables of firearms, so that we can begin to look at those with secondary analysis and see what we can learn. And then it funded a postdoc program, which began to train a next generation of firearm researchers so that we could start to fill the capacity gap we have in those knowledgeable specifically about firearm injury prevention and create an emerging pipeline for future research. One of the other things that we did was we began to have conferences on scientific conferences to discuss the standard methodological issues that one has with any research around firearm research. These began in 2017. This has eventually grown into what is a national conference now run by an independent society that is being created this year, the Research Society for the Prevention of Firearm-Related Harms. We'll hold a first conference, a next conference really, in this sequence in 2023 in November. Last year's conference, we had over 500 actually 600 researchers present working on all aspects of this type of injury, working to decrease towards our common goals of decreasing injury and death in the country. With that, next slide. I can end there, and I'll be happy to take questions.
Okay, sorry. Thank you so much. That was terrific. Really happy to hear all the progress you've made in building the research capacity after many years of decline. Could you talk a little bit about what the research has produced? Are there new approaches and ways of addressing these issues, particularly among, I would think, probably some of the higher risk groups like adolescents?
Yeah, so the studies we have funded out of I mean, I can talk about a variety of studies that I know that are going on in the country right now. Some are from FACTS and some are not. Some of the work that we did out of FACTS, first of all, has been a national survey of firearm owning parents and their children to try to understand the context in households, the risk of the adolescents and the storage patterns and practices and barriers to those by those adolescents and their families, to try to work towards what will then be creating individual messaging and support for increased safe storage. We have done some work collectively as in FACTS, pilot work on extreme risk protection orders and what their practical implementation is. These are being implemented across the country. With that, they're being implemented in a variety of different ways. April Zioli on our team has worked to understand what the impact is on children and their teens in multiple states, who petitions for them, why they petition for them, what happens after the petition happens. This is early foundational work that will start to build our understanding of the effectiveness of those policies. There was work done initially by our group to start to understand what kind of counseling could be done with physicians' safety check. Renad Beatis created a safety check intervention adoption for clinic settings to understand how to have what counseling could be done with physicians and those parents in order to increase safe storage, and that's being rolled out and examined now to understand those messaging. Those are some components. Other studies that are going on right now on our team. Dr. Pat Carter has done a lot of investigation in high-risk youth in urban emergency departments and rates looking at adolescents who may have had weapon carriage history in the past year and what we can do to decrease risk among those highest adolescents and how we can reach them. So a wide variety of approaches. And we're really just beginning to scratch the surface of the basic questions to be asked. Right now, there's about $25 million a year annually allocated for federal funding on this from the CDC and NIH. There may be some from other agencies as well as part of other programming that includes firearm work, but dedicated work on firearm research from the CDC and NIH right now is at about $25 million, which is a great start. But when we look at the levels of funding that have been needed to move motor vehicle crash death rates down, cancer death rates down, it will take a substantial amount more.
And we are a research advocacy organization. As advocates, what would be the most effective way to kind of amplify the work that you all are already doing?
The support for increased, if we want to see decreased death rates and even awareness about what's working and what's not working, we need research and researchers and funding. So for example, the part of the facts work that we had there is what was able to show that this was the leading cause of death. That's because there was research funding for us to have an analyst to be able to examine that data in this particular way and then highlight it. So forward momentum, including momentum on what's working and what's not, is going to take increased research funding and being able to collectively know that we're not going to come up with solutions by just sitting around and talking about it together. That's not how we found solutions to cancer. It's not how we found solutions to car crash. We have to fund scientists to do this. And so encouraging increased levels of funding by our federal partners, which is how we've decreased death rates on every other major health problem that the country has faced, whether it's been COVID or HIV or motor vehicle crash, has been by sustained large funding from the federal government to support researchers to advancing new knowledge that then can be rolled out.
Right. Right. I'll just ask one more quick question and then turn it over to Jacqueline for questions from the audience. But this may be more, I don't know how much research there is into this, but it does appear that just the number of firearms available is increasing, and that is increasing the incidence of, not just children, but people in general being injured by firearms. I'm just wondering if you've seen that in your practice or your research.
So the research data that exists demonstrates that there is an increased number of firearms being sold across the country every year. How that plays into causality is a separate question. But there's certainly more, we know that there's more firearms being sold and more firearms being bought across the country, and that those firearms have an increasing amount of lethality associated with them compared to firearms 10, 15, 20 years ago. So those are facts.
Right. Okay, I'm going to turn it over to Jacqueline to ask some questions from the audience.
Thank you, Sheila, and thank you, Dr. Cunningham, for your presentation. Very informative. So first question from the audience. You mentioned the federal agencies that support research in firearm violence are CDC and NIH. What mechanisms should they be supporting?
By what mechanisms? So, most of many NIH agencies have a role here. You saw our funding came before from NICHD, NIAAA, NIDA. Our older folks across the country are dying at very high rates by gun suicide. NIMH has a role to play here. The Aging Institute has a role to play here. DOJ has a role to play here, NIJ. So all of these agencies, certainly the CDC, if we think about how we're going to accomplish every angle, we need to take, there's no one solution here. We're going to have a multitude of different solutions across all these sectors and across all these ages. And the problem of how I keep an elderly gentleman in a rural state from dying by firearm by suicide is a different problem than how I keep a 5-year-old from having access to a gun in their mother's purse. So we have to approach those differently with different tactics, and we need different research and different data to move those ahead.
Great, thank you. Next question, who keeps track of state by state legislation these days, and where can it be accessed?
There is not, as I know, of a federal data, a broad database on that. They're available within the states. The way we've had access for our extreme risk protection order research by working with states individually. There may be another answer, but that's the answer I know.
Thank you. Next question, are there any summary documents that would describe the effects of legislation on gun-related deaths for this country or other countries?
Yes, and I'm looking here to find the exact site for you, but we did an evaluation in, I think it was 2018 or 2019, in the Journal of Behavioral Medicine, a special issue, which was specifically dedicated to firearm injury prevention. We did scoping reviews of that time of major topics including one was a description of the firearm laws and policy and outcomes among children and adolescents to understand the effect of those policies from a policy analysis standpoint. We also did a review of all the literature that existed on that time, again, funded by the NICHG, by children and among children and teens, on what we know about risk and protective factors related to firearm violence, what we know about adolescent firearm carriage via studies. What we know, something we're not talking about here also in terms of knowledge that needs to be generated, is after injury, there's also an awful lot we need to know to how to take care of our communities. You know, one shooting in a community right now impacts, you know, not only impacts the whole community, and at this point impacts the nation in terms of how we're interacting with our environments. And there's been some studies on the long-term consequences, for example, of youth exposure to firearm injury. But how do we help prevent the consequences after, both for the individual adolescent or child or family? And what do we do to mitigate that among our community so that we are healthier and don't experience the PTSD, the isolation and the fear that goes along with that? How do we help our communities heal? What does the evidence say? And then also primary prevention. We did a scoping review of the current evidence among primary prevention for children and adolescents.
Yeah, great. Thank you. Next question, can you elaborate on the postdoc program that you mentioned towards the end of your presentation?
Yeah, absolutely. So the original postdoc program was funded by NICHG and funded through our FACS program, which was, we trained, I want to say 7 postdocs at that time. The NIH has just allocated a new postdoc training program to Dr. Pat Carter here at the University of Michigan, who will be then training a next cohort of postdocs. Applications are open yearly, I do believe, to get engaged with the research that's here, as well as other researchers around the country, and learn the science behind specifically firearm injury prevention research.
Wonderful, thank you. Let me see if there's another question. Yes, we have another one, but then we may wrap it up after that. You touched on this a bit, but is there specific language we should be using in our discussions of firearm injury prevention to maintain a respectful and productive dialogue in a tenuous environment? Yeah, so
you know, at the end of the day, we all want to be safe. Nobody likes to be controlled. Nobody likes to be told they're going to be controlled. We don't tell people we're going to control their smoking. We don't tell people we're going to control their car. You know, the respectful language there is that we would all like to be safe, and we want to work together towards how we have safer communities, safer schools. And that language of control, I find not helpful. I find it not the way we talk about any other type of injury prevention issue that I know of. It's certainly not a way to talk to patients or friends that we want to control them. So that's language that I would suggest we strike, and we work towards goals around safety and goals around decreasing death and injury.
Right. Very helpful. Thank you. And I think our last, go ahead.
Another question, sorry.
Just one last question. Have you seen any changes in public sentiment regarding firearm injury prevention research in light of the societal impacts?
I think, you know, this is the place where it's hard to have hope in this field, but it's a place where I have tremendous hope and optimism. We've seen a tremendous change. When I started as a faculty member 20 years ago, I couldn't find a mentor or a senior faculty that would work on gun violence research with me at all. There were journals that wanted to change the title, wouldn't publish a title that had firearms in the title, we simply couldn't have these discussions. So there's been tremendous movement in that. You know, we have 600 researchers showing up last year who want to have active careers and focus and are studying this topic. So I think there's a tremendous increase in our ability and understanding that this topic can't be too political to talk about. We have to talk about this topic. If we talk about it simply as something that's killing all of our children, so many of our children and teenagers, we can't look away and decide it's too political to talk about it. We have to focus on our common goal of decreasing injuries and decreasing death. And I think most people will agree with those goals. So.
Great. Thanks very much, Dr. Cunningham. And I'll turn it back over to Sheila.
That's great. Thanks, Jacqueline. And Dr. Cunningham, thank you so much. And I'm really happy you were ended on a positive note too, because sometimes this problem, particularly for, just the image of your child in school and what could happen there, it can be somewhat overwhelming, I think, for families sometimes. So we really thank you for giving us the overall picture on the research, and very happy to hear that things are trending in a more positive direction. And thank you also to our audience for all your participation and questions. And before you go, I wanted to let you know about our next Alliance member meeting. It's this coming Wednesday, April 26th at 11 a.m. and it's members only. And it's an off-the-record conversation with CMS Deputy Administrator, Dr. Meena Seshamani. And we've asked her to discuss the current status of the implementation of the Inflation Reduction Act and the incorporation of external input and other aspects of this really important issue. So please bring your questions. And if you did not receive an email invitation, please contact Jacqueline, who will be able, and her email is in the chat, and she'll be able to send it to you. And Dr. Cunningham, thank you again.
Thank you for your interest.
Absolutely. And thanks everybody for participating. Take care.